and also Professor at Sensei University. Thank you, Miwako, for coming. Thank you.
Thank you very much for your introduction, Darren. So good morning, everyone. It is an honor to be here today to discuss issues of growing importance, the social and ethical implication and artificial intelligence in healthcare within a super engineering society. Before diving into my presentation, please allow me to introduce myself. So, as Dory introduced me, I'm a director of the IAA Inclusive Action for All. This is a charitable organization to support the children and the youth in need. And also, I'm a professor of Sensei University and teach sociology and public health. And also, I'm working as a Vice President of Asia Pacific Sociological Association and also the Japan Brain Injury Caring Community Society. So, and so in this year, in early December, the Asia Pacific Sociological Association will have a conference in Dhaka. So if you are interested in participating in this conference, please let me know. Actually, in my research, we would encounter with people living with various illnesses and disabilities. I have been making collaborative effort both domestically and internationally to seek out ways to help those individuals recover and empower them within their local communities from the perspective of medical sociology and bioethics and patient advocacy and global health. So my encounter starts from 1999. I met the people with stroke and got to know their power to recover and the support system. And also, I studied in the States for 8 years, and there I met a lot of patient groups and patient associations who support each other and doing the advocacy activities. So such patient advocacy group include brain injury, post-polio syndrome, sarcoma, it is a part of the cancer, and biologic encephalitis. It is known as chronic fatigue syndrome. And also, I create the collaboration between the patient and the medical professionals. So I'm supposed to invite the medical professionals to Japan and also the support for the patient group members to come to the States. So it is part of my publications. So if you Google my name, you will find some books, some written in English. So please take a look at it. And the foundation of my research is based on the idea that social factors play a significant role in people's health. This concept is known as the social determinant of health. Everything is related to support the health. So today I'm talking about the AI and health. So as societies around the world, particularly in East Asia and Europe, continue to age at an unprecedented rate, AI technology are increasingly being integrated into healthcare systems to support medical decision-making, caregiving, and resource allocation. However, this technological advancement raises fundamental questions about autonomy, self-determination, dignity, privacy, fairness, and the ethical boundaries of AI application. So we introduced super aging. So many of you know that the super aging society is defined as one in which more than 20% of the population is age 65 or older. Countries such as Japan, South Korea, and Germany are already experiencing this demographic shift. With declining birth rate and increasing life expectancy, healthcare systems are facing immense pressure to provide quality care within limited human resources. As AI has emerged as a potential solution, offering diagnostic support, robotic caregivers, and automated administrative processes. However, the adoption of AI also poses challenges to self-determination, which is a fundamental principle in medical ethics and bioethics. So there are several opportunities and the risks of the implementation of AI into the healthcare. So opportunities are AI-powered decision-making tools such as predictive analytics for disease progression or AI-driven treatment recommendations can enhance patient autonomy by providing more information and options. Self-determination refers to an individual's right to make decisions about their own life, including medical treatment and end-of-life care. There are also many risks. AI may also unintentionally undermine self-determination in several ways. The first, algorithmic bias. If AI systems are trained on base data, they may produce recommendations that do not align with the patient culture or personal values. The second, opacity and explainability. So many AI models function as a black box, making it difficult for patients and even medical professionals to understand how decisions are made. The third, dependency on AI. As AI systems become more advanced, there is a risk that medical professionals and patients may overly rely on automated recommendations, diminishing human agency in medical decision-making. So, self-determination, as the director said, it is a foundation of the bioethics. So the patients should have the right to make their own healthcare and medical decisions. And AI can enhance self-determination with this possibility. The AI can also undermine self-determination, so we have to be cautious about it. So ethical issues in AI-assisted healthcare, it has a double meaning. So several ethical concerns arise when AI is integrated into healthcare for elderly population especially. So informed consent, ensuring that elderly patients fully understand AI-driven medical recommendation can be challenging, especially if they have cognitive impairment. Maybe we have this kind of topic later. And the second, privacy and data security. AI relies on vast amount of personal health data, raising concern about data privacy, security breaches, and potential measure of sensitive information. And third, the social isolation and human interaction. While AI-powered robots can assist with caregiving, they cannot fully replace human empathy and companionship, which are essential for the well-being of elderly individuals. Maybe this kind of problem may overcome by the technology, but efficiency issues early, I think. So to ensure that AI enhance rather than undermine self-determination in healthcare, it is crucial to develop AI systems that prioritize transparency and explainability, and implement strict ethical guidelines and regulation for AI in healthcare. Promote a human-centered approach to AI, ensuring that it implements rather than replace human decision making. And last, that provide continuous education and support both medical professionals and patients to navigate AI-assisted healthcare. So as a conclusion, AI is essential for human healthcare in aging society, but ethical issues must be addressed. And maintaining self-determination, the fairness, and human dignity is key. And policymakers, researchers, and healthcare professionals must collaborate. So it is important to create the arena like this to discuss spontaneously and freely in their various positions. So thank you very much for gathering this conference, and I'm looking forward to discuss what the common issues together. Thank you very much. And to end this the presentation, I'd like to share the message from the former Japanese Prime Minister, Mr. Hatoyama. Mr. Hatoyama is representative director of the Kyowa Research Center, which is one of the collaborators of this conference. So please allow me to introduce his the message.
Good morning, ladies and gentlemen. Congratulations on the opening of the 23rd Asian Bioethics Conference. I'm Yukio Hatoyama, who served as Prime Minister of Japan about 15 years ago. I'd like to express my gratitude to our friend Ms. Miwako Hosoda, a member of the steering committee, for adding the Kyowa Research Center, of which I am the president, to the partner organization of this conference. This year's theme, social, legal, and ethical issues of artificial intelligence, was completely unthinkable a generation ago, but I think this topic is becoming very important now. Whether it's ChatGPT or DeepSeek, which is trending right now, each is made with its own algorithm. It is quite possible that different algorithms will derive different answers. For example, in the case of a territorial dispute involving two countries, it is possible that algorithms and data can be influenced by the state, so it cannot be ruled out that the will of the state will be included in the answer. While we want data and algorithms to be as fair and impartial as possible, it is important to understand that AI can also be biased. Also, it seems that it is not easy to make AI ethical, but it may be possible to make AI have a sense of ethics, for example, by building an algorithm that emphasizes Asian philosophies. In an era where AI is emphasized, there is no doubt that its social and ethical nature will become more and more important. In that sense, I have high hopes that this conference will be a great success. Thank you for your attention.
Thank you very much for your attention, and so I ask Gary.
So please stay there, we have some questions. Also, it's an interesting point. If you look at the controversies over DeepSeek when it's released, several were interesting. One is the low cost, apparently low cost of its development. Second was, if you started to ask certain sensitive questions, such as what happened in Tiananmen Square. The BBC asked at DeepSeek, and somebody may have tried this, initially DeepSeek started to give the answer according to international news stories, but then it deleted its answer saying, sorry, we cannot provide that answer. So BBC in the trials was testing, and so it's like the DeepSeek is confused. Initial response is seeking information, but then the censorship comes in later, and it's sort of interesting because it's meant to happen instantaneously, but actually the algorithms for censorship are not so perfect yet. But this is an example of what the Prime Minister Hatayama mentioned. It's, you can find it. It's one of the issues that, and of course I think the same applies to any technology in any country, whether ChatGPT will be controlled by the agenda of the United States. We recently saw the craziness of the Gulf of Mexico being changed by Google just to be in the good books of the current president of the United States. It's sort of very interesting. Miwako, maybe your comments on that?
Thank you very much. So as Dory mentioned, the ChatGPT it just refer the previous knowledge and the value of the former generation. So we have to be more creative and follow the different perspective to be the world society. So the change, it is be the change is the very attractive word. And so still, I think and I believe the change and the challenge is very important to improve the society. So yeah, of course, ChatGPT is and DeepSeek something to useful, but we have to manage and not to be manipulated by that new technology.
Any other comments or questions? Please go ahead. Please.
Present Dave, I'd like to ask what is the current situation in terms of these developments when it comes to Japan? I haven't heard a lot whether they are for or against many of these developments. For instance, in AI, including the policies of President Trump, the economic aspect of it, the tariffs, because incidentally this will also affect the development and growth of modern technology. So what's the position of Japan in terms of policy when it comes to these developments and trends that will of course affect many in the developing world, but Japan being in the forefront of technological development for so many years right now, how does your country react to these challenges at present?
Thank you very much for your question. So it is not an official statement, but for my impression, Japanese government are very curious and interested in implementing the AI technology. And however, so they had some, the cautious about the new technology. And for example, the education. So the AI technology and the ChatGPT and the AI technology is somehow effective to promote the education. However, we need to manage, not just follow the technology. So it's the same thing in the different areas, the other areas. So I think AI and the new technology, we cannot refuse, but to use the appropriate way, it gets more the effectiveness. So that is my point.
I want to ask you, let's say, Gedankenexperiment, German Wasserkultur. Super-aging society, let's imagine with dementia, what would the view be in Japan? That if AI is actually copying previous knowledge of the society, but let's say we copy the previous knowledge of Professor Miwako, and when, God forbid, that you get dementia, that we want her to be able to communicate and stay on our social science committee with Professor Suruchai. Let's say, Professor Suruchai, we want you to stay in the social science and master program until you're 120 years of age, because UNESCO will not let you retire. And so this means that in, God forbid, you get dementia, we're going to copy all your previous talks, create a generative AI like a Stephen Hawking's model, and then for the last 10 years when you're living with dementia, your presentations will be actually interfaced with AI generated. So the super aging society, wouldn't this be the natural consequence? And I think many of our young colleagues who are fascinated by Japanese anime and other technology would think, oh, that's wonderful. Imagine, so, or let's say you're a monk and you want to reach nirvana, and you think, well, actually there's a great habit that I want to emulate, and so let me copy, and when I have dementia, I'm going to read. So just think about this. Is this ethical or not, that we apply generative AI models? Let's say people with dementia, and some of us live with our loved ones who have had dementia, some of them are passed, some are still living. But we want them to show their love and wisdom for the last 10 or 15 years of their life, even though they have dementia. So the interface will be actually AI, not themselves. But we want them to continue. Is this acceptable in Japan, do you think, or up to people's self-determination? So let's say I get the consent of Professor Miwako, Professor Suruchai. I give my consent that, okay, you can use me for the next 50 years when I have dementia, plug me in and just keep on giving talks. If we give consent, would we tolerate it in our society, in a super aging society full of AI? So Sorad has worked on computers. I can't let go of his image. I need to keep him for the next Asian Bioethics Conference every 20 years. 20 years from now, 40 years from now, 60 years from now, he will be presenting. Is it? What do you think? Is it ethical?
So I think it's kind of the interaction between the people. So for my opinion, maybe people just interested in the continuously same the people and situation. So it is very hard to say the progress of human being. However, to be innovative and to seek the new pathway or the field is somehow the inspiring of the people's progress. So yeah, we need more discussion on it. So yeah, thank you very much. Such a great question.
Anybody else? Oh, some, please.
Thank you, Daryl, for that question, because I have a follow-up question. You mentioned the word progress in the future, so I want to tease that a little bit, if you don't mind. And at the risk of sounding oversensitive, I would like to make it practical. Last night I had actually a discussion on this very subject, exactly your points, with a young German doctor. I had dinner with him. I just randomly met around the UN building where I'm staying, and he said, why should we let the knowledge that is already in the AI cloud, wherever that is, dictate what we young people, and he's referring to himself and his generation, and I'm looking at our lovely, helpers, he said, basically what he was saying, Osama, why should we let your generation, and whatever knowledge you've created, dictate our future? Because he said that's what ChatGPT can risk doing. And I said, well, okay, if you're not happy with that, with whatever we wrote, because he knew I worked for the UN and I wrote all these papers, he knew my background. He said, if you're not happy with my work, why don't you write your own work? Tell us what sort of world would you like? And he actually referred to Nirvana, as you mentioned. He said, okay, for example, I believe AI, using AI is going to lead more people to go to heaven. And he said, okay, could you elaborate? He said, because AI will make people nicer to one another. And as more of us treat each other nicer, there will be less cruelty in the world, especially in the developing world. He's German, so he's been all over the world and comes from a very high level of human rights, compliance. He said, but the rest of the world is still cruel, and he thinks AI will make the rest of the world less cruel, and if people become nicer, more of them will go to heaven. And I thought, it makes sense, very logical, yeah? So this is an opinion from a young, very highly educated person coming from Germany. And now we have the Trump administration, and it just canceled, as you know, the DAI program, which is about diversity, equality, and justice. So he sent a memo, actually we received a memo in the UN saying no more, DAI funding stopped, please comply with this directive. It's a presidential directive, everybody complies. So that means the next 4 years, no Nirvana, cruelty will continue in the world. I don't know. What are your thoughts on this? Thank you.
The justice and the fairness. So somehow it is a universal, but somehow it is very different from the many perspectives. So human rights as well, they are the core and fundamental human rights. However, some people define the human rights in different ways. So we have to be very cautious about the definition of the concept, and we need to share and the way of thinking to the language. So of course, DI and E is denied in the state. However, people use the different language and do the same thing, even current administration.
Yeah.
So we can do more that and create a different way with creativity. So I'm not so optimistic about it.
Thank you.
Any other comments or reflections?
You have a very interesting presentation, and thank you for that. I see in your demography, Madam, the world's oldest populations. In 2054, you top, but in 2050, it's Hong Kong, followed by South Korea, and you are the third. This is promising. This is good report. What makes this possible? Is there any, what are the practical interventions Japan government or authorities doing to this projection? Is there, what are the mediations that you make in reducing this aging population? Because the world is watching on Japan's aging society, just like the rest of the world. Whereas to the Philippines, we still have plenty of babies. So, my question again, what are or is the intervention you make in your state or government as regards to how you so to say, control or mediate your aging population compared to Hong Kong, Korea, and other countries? Thank you.
Thank you very much. So, yeah, it is a big question, and I don't think I can answer a fully answer. However, in terms of the bioethic observation, the current elderly are under influence of the paternalistic medical decision making, and they follow the recommendation of the medical professionals, and they don't have much opinion about the decision making of healthcare and end of life care. However, currently the people started to assertive against the medical professionals, and also people decide how to facing the end of life stage. So also the Japanese government promotes the end of life care and the end of life planning. So people, I hope that people can be more independent and have the original perception to the end of life, and also the how to be cared by the others, and also the people make a self-decision making and self-determination of the healthcare. So I think we need more the kind of the so-called health literacy, and even especially in the aging society, people have their kind of the own decision making. But in this case, we have to be very cautious about to give the responsibility to individual. So the social protection and the social security the welfare security is really fundamental and important for not only the elderly but also the people in need, like people with disability and illness. So to make a balance, again the balance is really important.
Thank you so much. Thank you very much, Miwako, for stimulating us. The next presentation, which is changing order a little bit, will be on integrating indigenous knowledge with ethical AI to promote social sustainability. And I'd like to invite Vivian Yu Wong Chin from Malaysia to present, and Professor Chai will talk after Vivian.